Hi, my name is Lori Smoot, and this is my son, Thello. How old are you, Thello?
4.
And how many open heart surgeries have you had?
4?
3.
Oh.
Thello has a severe form of congenital heart disease called hypoplastic left heart syndrome. Can you say that?
Mm-hmm.
Hypoplastic
Hypoplastic left heart syndrome.
There you go.
I'm Dr. Rachel Torok, a pediatric cardiologist and one of the investigators for the STRESS study. My goal, and the goal of all the doctors, surgeons, nurses, and other staff that are participating in this study, is to improve outcomes for children like Thello, who are born or living with heart disease.
When your child is diagnosed with heart disease, it is one of the most difficult times of your life. Know that you're not alone. You're joining a community of experienced doctors, nurses, and countless others who care deeply about children diagnosed with this disease.
We are asking you to consider enrolling your child in a clinical study to help us determine the best course of treatment for children undergoing surgery for heart disease. The purpose of this video is to tell you why the research is being done and what it involves, so you'll feel comfortable if you decide to let your child participate.
Clinical studies are critical to advancing medical care and finding solutions that will improve children's lives. Participation in these studies is always voluntary, and you should take time to think about it and talk with your family before signing the consent form. The sites for this study were selected because they are highly rated children's heart surgery programs with excellent outcomes. Ask the study doctor or any staff any questions you may have. You and your family are in good hands.
When your child undergoes heart surgery, the surgeons use a technique called cardiopulmonary bypass. This temporarily takes over the function of the heart and lungs during surgery. Although cardiopulmonary bypass is necessary to repair most heart defects, it causes inflammation that can slow recovery and lead to complications. To prevent inflammation, some surgeons give a steroid known as methylprednisolone before surgery. However, other surgeons believe that this steroid does more harm than good. We simply don't know which of these options is best. The main goal of this study is to determine whether methylprednisolone is safe and effective in children younger than 30 days old who are undergoing surgery with cardiopulmonary bypass. About 1,200 children will take part in this study at different hospitals across the country. They'll be randomly assigned to 2 different groups. One group will receive methylprednisolone during surgery, and the other group will receive a placebo, which is an inactive substance made to look like the study drug.
No one, not you, the surgeon, or the study team, will know whether your child is getting methylprednisolone or a placebo. However, this information will be available to the study doctor in case of an emergency.
During the surgery, your child will receive the methylprednisolone or placebo through an IV. Because your child already needs an IV during surgery, there is no need for any additional needle sticks. Methylprednisolone has been used for many years to treat children and adults with asthma, allergic conditions, and kidney diseases. Side effects are generally rare, but please review the consent form carefully for possible risks. The surgery will then be performed the same way as if your child were not enrolled in the study. After the surgery is completed, your child will undergo routine postoperative care. Please know that your child will receive the same high level of care whether or not he or she is enrolled in the study.
Thello and I would like to say thank you.
Thank you.
For considering taking part in this study. The knowledge gained from your child's participation may help other children just like yours who undergo heart surgery in the future.
On behalf of the STRESS trial investigators, surgeons, doctors, nurses, and the rest of our community who care about children with heart disease, thank you for your consideration, and know that regardless of what you decide, we're all here to support you.